Hi everyone, this is Dr. Cody Al from Baseline Chiropractic, here to provide another video for you this Wednesday. So, last time I talked about the joint by joint concept or approach, which had two components, mobility and stability. So today I'm going to focus on mobility and speak about the importance of mobility and what can occur when mobility doesn't work out. So, mainly we're going to be focusing on this left side of this diagram from where I'm showing it says mobility. So a recap of what the joints that are mainly made for mobility are the toes, the ankles, the hips, the upper back, shoulders, the upper neck, but also the wrist is added into this component as well. So the first question to ask is, what is mobility? Mobility is actually defined as your ability for a joint. So a joint is the connection between two bones and its ability to move before restriction from other tissues like ligaments, muscles, everything else stop that motion. So when we look at mobility and we look at these joints are some of the joints that have the most range of motion that we have in the whole body. For example, like the shoulders and the hips, they're characterized by ball and socket joints. So basically, they move like this, and so they have a great deal of mobility that needs to be there, and that's why they're designed that way. So the problem with mobility is a lot of these joints actually end up losing their mobility as we go through injury, as we go through regular periods of life. So oftentimes we don't realize that that's happening, and that can be something as easy as walking off of a sidewalk, spraining your ankle, or sitting in your desk for extended periods of time can cause some of these mobility issues. And so we don't usually realize that they're present until something else starts acting up. So, a great example of a mobility issue that can lead to other problems is something that's very relatable, a sprained ankle. So, when someone does an activity, they sprain their ankle, say they sprain their right ankle, the body starts changing and bracing that ankle. So, you get swelling, you get pain, and you get a limited range of motion. So what happens after that? So the process is typically we start limping, we start favoring that ankle and wait until the swelling and the healing starts and finishes and allows you to move properly again. So we think. However, the ankle oftentimes will not regain those ranges of motion because it's been injured. So your brain is protecting it. And the second part is some of those structures just haven't healed fully. So oftentimes we may not feel anything in the ankle, but later on, maybe a month later, 2 months later, your knee starts hurting. Why? The question is, the answer to that, I guess, to that question is your knee is actually compensating for that ankle. The knee is primarily a stable joint, but because it's lacking motion where your ankle is, the knee has taken on some of those forces. And as a result, the knee is not made for mobility and is acting out because of the issues that you haven't resolved with your ankle. So mobility is incredibly important for our bodies, and it's what keeps us active and moving. And so in future videos, we'll be breaking down every aspect of these joints and showing you different exercises that you can do for mobility. If you're interested in these videos, please like, comment with questions or other topics that you would like to hear about, and share this with other people who you feel that would have great benefit from hearing about this. I'm Dr. Cody Al from Baseline Chiropractic. Get back to your baseline, and we'll talk to you soon.